against infections caused by bacteria and viruses. A normal immune system leaves healthy body tissues alone. But for people with RA like Pam, the immune system attacks healthy body tissues, causing damage and inflammation, especially in the tissues of her joints. Orencia is a medicine that keeps the immune system from attacking healthy tissues in the body. By doing this, Orencia can reduce pain and joint inflammation and slow the damage to bones and cartilage. Orencia can lower your body's ability to fight infection. It can make you more prone to infections or make any infection worse. Orencia can cause serious side effects, including serious infection, allergic reactions, and malignancies. The more common side effects with Orencia are headache, upper respiratory infection, sore throat, and nausea. Not everyone's results will be the same. But when Pam began her infusions of Orencia, the inflammation decreased and her pain lessened. By her fourth infusion, Pam and I really started to see a difference, and she continued to improve over the next 3 months. Today, she is still doing well. Plus, her health-related quality of life has improved, both physically and emotionally.
There's another person vital to my support team, Bill, my husband.
From my point of view, Orencia has really made a difference. Prior to beginning treatment with Orencia, Pam's RA symptoms were making things difficult for her, and for us. We've always enjoyed activities like cooking and family get-togethers. With the joint swelling and pain, these things were sometimes hard for her. As for the infusions, the first few times I went with her to the rheumatologist's office, I was quite impressed. Everyone was very professional. But it was also very reassuring. And I saw that Pam was comfortable with the whole infusion process. The visit usually lasts about an hour, and Pam pretty much gets back to her daily routine after it's over. Once in a while I go with her because there's a restaurant near the doctor's office that we like, but most of the time she goes by herself. Now, the doctor explained that how soon a patient improves after receiving Orencia varies from person to person. It didn't happen overnight, but since beginning treatment with Orencia, Pam is more physically able to do what she needs to, which makes her feel better emotionally too. And now we can do more of the things we want to do together. And I'm happy to know that she's being looked after during the infusion, and Deborah, the nurse at Dr. Miller's office, has served as a great resource for answering our questions.
Thanks for letting me show you my Orencia experience. I hope that I've answered some of your questions. Please visit the Orencia website at orencia.com for more information and talk to your rheumatologist or nurse during your next appointment.
Orencia or abatacept is a prescription medicine that reduces signs and symptoms in adults with moderate to severe rheumatoid arthritis, RA, including those who have not been helped enough by other medicines for RA. Orencia may prevent further damage to your bones and joints and may help your ability to perform daily activities. It is important to tell your doctor or other healthcare professional about all of your medical conditions before you begin treatment with Orencia, including if you have any kind of infection, such as an open cut, an infection that is in your whole body, such as the flu, an infection that won't go away, or if you are prone to infections. Tell your doctor if you have had tuberculosis, TB, have recently been in close contact with someone who has TB, or if you get any of the symptoms of TB, such as a cough that doesn't go away, weight loss, fever, or night sweats. You should also tell your doctor if you have had viral hepatitis. Tell your doctor if you have recently had or are having surgery or a vaccination, or if you have a history of chronic obstructive pulmonary or lung disease, also called COPD. If you are allergic to any of the ingredients in Orencia, including abatacept, maltose, monobasic sodium phosphate, or sodium chloride for administration, or if you use a blood glucose monitor to check your sugar levels. It is also important to tell your doctor if you are pregnant, planning to become pregnant, or nursing. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements, especially if you take other biologic medicines to treat RA, such as Enbrel, Humira, Remicade, Kineret, or Rituxan. You may have a higher chance of getting a serious infection if you take Orencia with other biologic medicines. There is also other important information you need to know about possible side effects with Orencia. You have a higher chance of getting serious infections when receiving Orencia. Call your doctor right away if you feel sick or get any of the following signs of infection, like fever, feeling very tired, cough, feeling flu-like, or warm, red, or painful skin. Orencia can cause allergic reactions. Tell your doctor or get emergency medical help right away if you have hives, swollen face, eyelids, lips, tongue, throat, or trouble breathing. There have been certain kinds of cancer reported in patients receiving Orencia. It is not known if Orencia increases your chance of getting certain kinds of cancer. You should not receive Orencia with certain types of vaccines. Orencia may cause some vaccines to be less effective. If you have COPD, you may get certain respiratory problems more often when receiving Orencia, including worsened COPD, pneumonia, cough, or trouble breathing. The more common side effects with Orencia are headache, upper respiratory tract infection, sore throat, and nausea.